Hello, and thank you for joining us for today's Health Leaders Fellowship webinar. I'm Mara Herman, Health Policy Specialist here at the Ecology Center, and I'll be your moderator for today. Currently, all attendees are in listen-only mode. If at any time during the webinar you have a question, please use the chat box to share it. After our presentations, we'll have time for questions. Please note today's webinar is being recorded, and materials from today's presentations will be available tomorrow. Our learning objectives for today are as follows. After today's webinar, you should be able to identify adverse health outcomes related to flame retardants and PFAS. And we're lucky to be joined by two presenters this afternoon. First up, we have Courtney Carignan. Dr. Carignan is an environmental exposure scientist and epidemiologist whose research helps protect reproductive and child health by investigating exposure to mixtures of ingredients and contaminants in consumer products, drinking water, and food. She has conducted biomonitoring and health studies for a wide range of populations, including infertile couples, pregnant women, infants, new mothers, office workers, gymnasts, and communities exposed to contaminated drinking water. Dr. Carignan holds a joint appointment in the Department of Food Science and Human Nutrition and the Department of Pharmacology and Toxicology. She has received numerous awards, including the Catherine Skinner Memorial Prize for commitment to the study of women's health issues, Champions of Toxics Use Reduction, and Pioneers Under 40 in Environmental Public Health. Our second presenter for the day is Elaine Chottiner. Dr. Chottiner earned her medical degree from University of Michigan, followed by completion of a residency in internal medicine and a fellowship in hematology and oncology. She was then on the faculty of the University of Michigan Medical School, where she was involved in teaching, clinical activities, and laboratory research. Later on, she returned to the University of Michigan in 2011 as the Director of General Hematology until her retirement. Her career has been devoted to caring for people with blood disorders and cancer, many related to environmental, genetic, and lifestyle factors. An important part of her job was understanding and explaining these factors. She now applies these skills to educate communities and to advocate for policies that reduce risks, including participating in the Health Leaders Fellowship Program in 2018. So with that, I'm going to turn it over to our first presenter, Dr. Carignan.
Hi, thank you so much. Can you hear me okay?
Yes, we can hear you perfectly.
Okay, great. Let me share my screen. And can you see my screen okay?
We can see your screen, but we cannot see your slides yet.
Okay. How about now?
Yes, perfect.
Are you seeing just my slides, or are you seeing my presenter view?
Nope, just the slides.
Okay, we were working on this before, so perfect. And yeah, just feel free to jump in if I'm going to talk, but feel free to just jump in, okay? So today I'm going to talk about broadly flame retardants and highly fluorinated chemicals, and I'm going to talk a little bit about my research, but mainly I'm trying to take a broader approach to this talk today. So flame retardants are chemicals that are used in many products to improve fire safety, but they do not always work as promised, and they can pose some health concerns. So products that flame retardants are added to include the plastic casings of electronics, polyurethane foam that's been used in upholstered furniture, and other products that contain polyurethane foam, like children's mattresses, and I'm trying to think, there's so many things as you start looking at polyurethane foam. It's also used in spray foam and blue board insulation, some textiles that are fire resistant, children's infant car seats, and a lot of the materials inside of transportation vehicles, carpet padding. I forget what it's called, but it's when it basically recycled carpet padding. It's taking recycled polyurethane foam and turning it into carpet padding, and foam blocks and landing mats used in gymnastics, training facilities, and other places like that. The perfluoroalkyl substances, or PFASs, are used to provide stain and water repellency. And while convenient, they've also been associated with serious health problems and can remain in the environment forever. So some of the products that PFASs are used in include Scotchgard, which is used to treat upholstered furniture and leather. Stain-resistant carpeting, water-resistant clothing, food packaging like microwave popcorn bags, and the paper packaging, water-resistant paper packaging like in the past was used in pizza boxes, and parchment paper, Teflon pans, so kind of your historic nonstick pans. Ceramic pans now don't contain PFAS, to my knowledge. Firefighting fuel is used to fight fuel fires, so this is called aqueous film forming foam, or AFFF. Also can contain PFASs. So, both PFASs and flame retardant chemicals are man-made. They're manufactured, put into products, and disposed of. They can make their way from industrial plants, landfills, and wastewater into waterways, and then into our food and our drinking water. That's particularly the drinking water part for the PFASs. Depending on the chemical that you're talking about, they may have more or less ability to migrate into groundwater, for example, depending on their properties. PFASs very easily migrate through the soil into groundwater, and that's part of the reason that we're finding them in drinking water sources all over the place. These chemicals, they're transported all over the world, and they accumulate in polar regions. They bioaccumulate up the food chain, some of them, so the persistent ones, like the more persistent, well, most of the PFASs, and some of the historic flame retardants that I'm going to talk about in a minute. So marine mammals can contain some of the highest levels that have been measured in wildlife, and people living in the far north have some of the highest levels that have been measured in humans. PFASs and flame retardants are found in the bodies of most Americans. Fetuses and children are especially vulnerable during critical windows of development. Babies are born with the same level of flame retardants as their mothers, and are further exposed to flame retardants and PFASs through consumption of breast milk. These chemicals are continuously migrating out of products into air and dust, and toddlers have 3 to 10 times the levels of flame retardants as adults do. The polybromine diphenyl ethers are a class of flame retardants that was used heavily for several decades, particularly in the United States. One of the PBDE technical mixtures, penta-BDE, was used primarily in polyurethane foam and was phased out of use in 2005 due to concerns about its persistence in the environment and our bodies, and its effects on health. The half-lives of PBDEs are in the order of years, so that means it takes between 2 to 8 years, depending on the PBDE congener, for half of the level in that body to be of that chemical in the body to be eliminated. When they were phased out of use, we saw an increase in use of other flame retardants in polyurethane foam. We kind of started referring to these as replacements. So these included chlorinated tris, or TDCIPP, tris 1,3-dichloro-2-propyl phosphate, and also the Firemaster 550 mixture, which is a mixture of brominated and organophosphate flame retardants. Some studies were done that showed that the safety and effectiveness of the flame retardants were not as advertised, and this is because the upholstery, at least for flame retardants being used in upholstered furniture, the upholstery catches fire first, and so studies showed that there wasn't really a whole lot of benefit of using the flame retardants in the polyurethane foam in upholstered furniture. And in fact, the use of the flame retardants created more toxic smoke and gases, which are the leading cause of death in fires. And so this led to a change in a flammability standard, a revision in 2013, to change the type of, sorry, I don't know why the timing on this keeps going, to change the way that the standard was set so that it considered the whole product. And so we were able to maintain fire safety in upholstered furniture without the use of flame retardants. And now when you buy upholstered furniture, you can check the tag to see whether or not it contains added flame retardant chemicals. I've done some studies, biomonitoring studies. One was on workers. We found that levels of flame retardants were higher in office workers. They differed by the building, and they were lower among people who reported washing their hands more frequently. And we think that is related to hand-to-mouth contact, so in accidental ingestion of dust as an important exposure pathway for these chemicals. We also found higher levels in nursing mothers. We were using that as a biomarker of exposure with a larger number of stereo and video electronics. And that's consistent with the use of the flame retardant in that study was hexabromocyclododecane, or HBCD, with the use of those that flame retardant in the plastic casings of electronics. I also did a study that discovered flame retardants, very high levels of flame retardants in gymnastics training facilities. And this is because of this, you see here, this foam pit. It contains polyurethane foam blocks, known as pit cubes. And these pit cubes are polyurethane foam. They are typically uncovered, or they may be covered, but it doesn't really matter. The flame retardants will migrate out of the foam blocks into the air and dust to the gym. We found levels in gymnasts that were 4 to 6 times higher than the general population. So that was in competitive collegiate level gymnasts. We spend a lot of time in the gym. We found levels in the foam pit that were orders of magnitude higher than have been measured in any other indoor environment, or outdoor environment for that matter. We found higher levels in and near the foam pit for air and dust compared to other parts of the gym and further away from the foam pit. It was clearly a source, and so we conducted an intervention study where we paired with a flammability study to determine the added fire safety of using flame retardants in the foam pit, brought that to some fire marshals, and in Massachusetts they determined that, came up with a checklist so that gyms can maintain fire safety without the use of these chemicals in their foam equipment. And so a lot of people are familiar with how much kids and people in general like foam pits. And so you know, this can be an important exposure scenario for folks. So it's an important, I think it's an important topic. To try to communicate this, I established the Gymnast Flame Retardant Collaborative. So if you have any more, I don't want to get into it a lot, but if you have more interest in this topic, you can go to our website and find more information there. And you can also contact me if you're interested in getting involved for gymnasts or for other indoor recreational environments. So flame retardants have been shown to affect health. They're endocrine disrupting chemicals. Particularly, they can disrupt thyroid hormone in the body. They have been linked to decreased IQ and behavioral problems, both in animal and human studies. And TDC-IPP in particular, the chlorinated tris, has been linked to cancer. I did some work looking at fertility and flame retardants in the environment and reproductive health study. So this is a preconception birth cohort that enrolls couples undergoing in vitro fertilization or fertility treatments in the cohort preconception, and uses this sort of as a model for looking at the effects of these chemicals on reproduction, because we're able to, in an IVF cohort, see some, I guess I'm not really going to get into it, but things like oocyte count, fertilization success, implantation, clinical pregnancy, and live birth. And so here are some results from that study very briefly. We found that significant declines in the adjusted means from the lowest to the highest quartile of the sum of organophosphate flame retardants measured in metabolites measured in urine for the proportion of cycles that resulted in implantation, clinical pregnancy, and live birth. So we saw a reduction here from the first, so these are here quartile 1, the people with the lowest levels of these flame retardants in their urine, and the people in quartile 4 have the highest, right? And so looking at implantation, you can see a 31% decline in the adjusted means. For clinical pregnancy, that was 41% decline, and for live birth, it was a 38% decline. And if we looked at this by individual PFR metabolite, we can see these similar trends. What was interesting to note here was that that association was strongest when we summed them, suggesting a cumulative effect of exposure to mixtures of organophosphate flame retardants. We think that our findings are clinically relevant, so that translates to an 18% decline in the adjusted difference of the proportion of live births. So I should have mentioned, often when I give this talk, I talk about the fertility epidemic. So that study that I was working on is really looking at factors that affect fertility, and in particular looking at nutritional and chemical exposures that can affect fertility. So, the study suggests that flame retardants may be one of many factors affecting human fertility. PFOA and PFAS, so I'm going to get back to the fluorinated chemicals, switching gears a little bit, but kind of going along with that theme of replacement, right? So this idea that chemicals that are found to be harmful can be replaced with sort of chemical cousins. So PFOA and PFAS, so these are PFAS chemicals that I mentioned earlier, are called C8 because they have 8 carbons, and they were phased out of use due to their toxicity and persistence. So similar to the flame retardants I was talking about before. And hundreds of replacements are now in use. So these chemical cousins, less is known about their safety. And traditional water filtration methods have been shown to be less effective at removing these replacement PFASs from contaminated water. The most studied of these chemicals, so the PFOA and PFAS, have been linked with elevated cholesterol in both animal and human studies, changes in immune and hormone function, decreased fertility, and kidney, testicular, and prostate cancers. I contributed to a study that found that over 6 million Americans in the United States are served by water systems impacted by PFAS contamination, and that water systems closer to PFAS using or producing industrial sites, military fire training areas, airports certified in the use of the AFFF firefighting foam, and wastewater treatment plants were more likely to have detectable levels of these of PFASs. So, and detectable here was defined as greater than 70 parts per trillion, which was the health advisory, which is a health advisory set by EPA. Since that study was published, more monitoring has been undertaken, and more drinking water contaminated sites have been identified. So here you can see that Michigan in particular, which is where we are, has an awful lot of detections, and part of the reason for that is because Michigan has launched the most comprehensive drinking water monitoring program out of any of the states. And so one thing that we can conclude from this is that if you look for it, you will find it. And so Michigan now has, and I think this might be a little bit outdated at this point, but it has somewhere around 30 drinking water systems with PFAS detections above the 70 parts per trillion health advisory, and I think around 100 with detectable levels. And so some of those include, some of the more highly contaminated sites include Oscoda, which is up by the former Portsmouth Air Force Base. So this is where they used the aqueous film forming foam extensively in the past. The northern Kent County area, so the contamination there has been linked to the Wolverine tannery, where PFASs were used to in the production of hush puppies, essentially. Parchment, Michigan, where there was a former paper mill that PFAS contamination was associated with, likely due to the production of, and I don't know if it was food packaging, but certainly paper products probably containing PFAS. And then plating facilities, I believe, is the major source for the contamination out by you guys. A number of drinking water interventions have been used depending on where the contamination is, if it's a private well or if it's a municipal water system. So these include installing filtration systems in someone's home, right? If it's a private well, putting in large carbon or treatment systems. I recently heard of one that used reverse osmosis. That's probably a conversation for another time. So reverse osmosis is more effective on some of these replacement PFASs than carbon filtration is. However, I've been told it can't be scaled up to a municipal level, so that's something that's still sort of being worked on. Sort of in the short term, providing people with bottled water, and this bottom right picture is showing the line flushing that was done in Parchment for the municipal water system as they were switching to another public water supply. Communities in these impacted areas, some have fish advisories, are being told not to eat the produce from their gardens if they've been watering their gardens with PFAS contaminated water. Up near Oscoda, there's actually a deer consumption advisory because a deer was found in a survey to have elevated levels of PFAS in the meat. And Oscoda also has this unusual foaming situation that's happening on the lake there, Van Etten Lake, where this foam that contains very high levels of PFAS is piling up under certain scenarios. And people are now being told not to touch or to eat this foam. I already mentioned the communities, but Portsmouth Air Force Base in Oscoda, Wolverine Tannery, Northern Kent County area, and the Parchment area are three of the sites with some of the highest and most extensive PFAS contamination that's been discovered. And this has led to some community action and formation of Need Our Water community group up in Oscoda. Michigan demands action against contamination in the Plainfield Rockford area. It's also led to the establishment of the Michigan PFAS Action Response Team, which is an infrastructure for the various Michigan agencies and departments to communicate with each other on this issue as they work together in addressing this problem. It also led to the development of the MPART Science Advisory Board, which put out a white paper, I think earlier this year or last year, concluding in which one of the conclusions was that research supports the potential for health effects resulting from long-term exposure to drinking water with concentrations below the 70 parts per trillion health advisory that was put forth by EPA. So there's been some debate. I'm not going to get into it a whole lot, but some states have been passing lower drinking water guidelines. And so that's been a topic of conversation here in Michigan as well. And actually Michigan has since proposed as screening values, so not yet enforceable, but in the single digits as proposed drinking water levels in Michigan. So common community questions often relate to exposure reduction. Very nuts and bolts kinds of questions about reducing or eliminating PFAS from their drinking water and their household water. So drinking water and household water can have potentially different approaches depending on cost and the levels in the water. Questions about safety of swimming in their swimming pool and dermal absorption, which I think Elaine is going to get into a little bit. Is it safe to eat my garden vegetables? And fish and wildlife. And so I'm now involved in a study that's going to be gathering some more data in collaboration with teams in Colorado and North Carolina to try to address these questions for communities in Michigan and other PFAS impacted communities across the state. Across the country. Other questions communities have, what are the levels of these chemicals in my body or my child's body? How long will it take for the levels in our bodies to go down? And how do my levels compare to levels of harm? And so I also have another project that I'm working on that is trying to provide some tools for communities to provide information to these questions. A lot of the work that's been done so far in trying to in answering these questions is conducting of biomonitoring studies, and several have been conducted at this point for communities with impacted by PFAS contamination. I've been involved with one for the past 5 years at Pease Tradeport in Portsmouth, New Hampshire. So this is similar to Oscoda, a former Air Force base that had training with AFFF on site. I don't know if you see here in the picture, here's the flight plane, and the training was taking place up here. They would actually pour fuel on the ground and practice, light it on fire and practice putting it out. So they had known contamination associated with the jet fuel discharges, and they had a pump and treat system in place, I think, for the past 20 years. But they didn't know about the PFAS, or they weren't paying attention to it. So 5 years or so ago, they discovered the PFAS contamination. There was a drinking water well right under this airfield here, and the PFAS had, migrated to the drinking water, and they had turned this former Air Force base into a trade port. And so there's now 9,000 people now that work in office buildings on the trade port that were drinking water that came from this contaminated well and 2 others. And so they shut down that well, and we're using the other 2 wells. Anyways, because of the daycares in particular, parents were very concerned about this issue and got pretty involved and asked for biomonitoring. And so the state and the federal government provided biomonitoring for about 2,000 people at Pease Tradeport, including 200 children, and compared the central tendency values for Pease Tradeport, adults and children, to other populations, including the general population, and to up here other, so these are actually communities near our manufacturing facilities that release PFAS into the environment. So you can see that levels here for PFH-XS, which is a PFAS chemical that is tends to be higher in AFFF, was elevated for these communities compared to the general population, and also compared to and also, more similar to these more highly exposed populations. And you can also see that for PFH-XS, that here we're looking at a distribution of the population, and 40% of the Pease population was above the NHANES 95th percentile. So this is the general population, sort of what you'd maybe say is some of the highest levels in the general population. 40% of the Pease population was above that. And if you took and you mapped their blood levels over by age group, so here we're looking at PFOS in purple, PFOA in red, and PFH-XS in green, and then PFNA, which was not really in the drinking water. And we know something about the site, which is that children were at daycare on Pease. So here we're seeing an increase as a child was at daycare, by age, and then they stop being at Pease because they go to school, and they're not being exposed to the water at Pease anymore once they reach kindergarten. And then if they're working age, presumably they've been working at Pease, and so you see as people are older, we see an increase again. So I thought this was a really kind of elegant graph that tells the story of, you can see the effect of the drinking water if you sort of know this population. So we are now working with the Pease population and also a population in Cape Cod that also has a FFF-impacted drinking water, to look at effects of PFAS on children's immune systems, to develop an online resource center, and to investigate experiences of the exposure experiences in affected communities. And that's in partnership with Silent Spring Institute, Northeastern University, and Testing for Pease, which is the community action group there. Also working with that same group, I'm helping organize the second national conference, PFAS in Boston, which is actually taking place next week. And we will be posting, the presentations are going to be recorded, and so you should be able to see those probably a month from now. They should be available online. And with that, I'm going to hand it on over to Elaine, unless anybody has any questions.
Great, we're going to switch the slides here. Just give us a moment. Okay, can you hear me? We're unmuted. Can you hear me okay?
Yes.
We can hear you just fine.
Okay, great. Before I started this fellowship with the Ecology Center, I had actually never heard of PFAS. It was certainly not in the oncology literature. So when it was time to do the practicum, I asked Becca if I could do something on PFAS, because I was struck by the fact that although we had looked at presentations, I had read a lot of literature, there was relatively little known about what diseases it actually caused. And Becca said she thought that was a great idea to do a literature review, but she wanted me to focus also on the short chain PFAS compounds. So that literature review, I think, is going to be posted after the webinar. And I went ahead and I entered a journey down the rabbit hole. So I will briefly share with you some of the information, although there's a lot more that we could talk about on this subject. So how do PFAS get into our bodies? The highest risk is through contaminated drinking water, also eating fish or wildlife that have been exposed to contaminated water, plants, and this is an issue with the short chain, because it turns out that the short chain PFAS actually can diffuse up into the edible portion of plants. So while the longer ones like PFOA and PFAS don't, you can eat lettuce that's been contaminated by the short chain. I didn't even have this in here until yesterday, which is eating food contaminated by packaging or in the manufacturing process, because most of that packaging has been removed. But the next slide briefly. There was a report just this week that the FDA made a presentation in Europe about a study looking at the levels of PFAS in food, and they found levels in grocery store meats and seafood, but also in off-the-shelf chocolate cake, which had PFAS 250 times higher than the federal guidelines. That report has not yet been published, but when it comes out, it's going to be very interesting to look at those data. The hand-to-mouth transfer is an issue for toddlers and infants exposed to carpeting and fabric, as Courtney explained. There is also demonstrated placental transfer through the umbilical cord to the fetus, and this is very important in fetal development. PFAS has also been detected in breast milk, although the concentrations are significantly lower than maternal serum levels, and we're careful to let women know that the benefits of breastfeeding far outweigh the risks. How do PFAS get into our bodies? Also inhalation, although this is probably mainly an issue around manufacturing and disposal sites. It can be inhaled, if dispersed as liquid droplets in air, in contaminated dust or spray. And some of the shorter chain ones can actually be inhaled as vapor in steamy showers and baths. Dermal absorption is fairly poor and has not been shown to be a major factor, in contrast to some of the lipophilic compounds such as the dioxins. Bathing and swimming in PFAS-containing water has also not been shown to be a significant risk. But now that we're seeing a lot of foam in some of these lakes and rivers, it's important to avoid that because they do contain high concentrations of PFAS that you can swallow or that your pets can drink. So what happens once it gets in? PFAS are absorbed into blood, they're filtered, and they're reabsorbed by the kidneys, then bound to plasma proteins, primarily albumin, and freely distributed to tissues throughout the body, including liver, lung, brain, bone, and reproductive organs. PFAS build up in tissues. You think it was kind of strange to think that we have to worry about eating the fish and the deer with bioaccumulation and don't stop to think about the fact that we're accumulating it as well. And there was one very interesting study done in Italy in a population that was highly exposed. Autopsy studies showed measurable levels in brain, liver, lungs, kidney, and bones. We know that blood PFAS levels decrease over time if there's no ongoing exposure, but we don't know for certain how much of this is due to elimination through the kidneys or whether some of it is simply deposited in tissues where it can remain forever. How long does it take to be eliminated? Well, there are over 5,000 different types of PFAS now. There are carboxylic acids and sulfonic acids, and there are side chains and different compounds, and we have data for only a few PFAS. We do know that in general, the shorter ones tend to be eliminated faster than long chains, but there are significant exceptions, which you'll see on the next slide. Absorption and elimination rates also vary widely among species, meaning that the animal models, in particular those that were done by DuPont and some of these companies in order to get these on the market, don't work well to predict how they're going to behave in humans. The absorption and elimination rates also vary between males and females because women tend to absorb more PFAS and it takes longer to eliminate them. This is a chart with the elimination half-lives. You know, PFAS and PFOA are the ones that have now been phased out. The shorter chain ones in use right now, like PFBS and PFBA, do have shorter half-lives, but look carefully at PFHXS, which is a 6-carbon compound that actually has a half-life of 8.5 years. And this is important because it's being detected with increasing frequency, and it has been reported in the Ann Arbor Huron River supply, probably because of the firefighting foam and flame retardants. So what do we actually know right now about the health impacts of PFAS? We have the toxicological data performed by the manufacturers. Again, probably not very relevant to human health. We have epidemiologic data suggesting links to several health disorders. And when I started this project, one of the reasons was that people would say, well, PFAS causes this, but we don't really have any causal data, we have links. We have risk assessments that have been done by several regulatory agencies in the US and Europe, including the EPA and the Agency for Toxic Substances and Disease Registry, and by advocacy groups such as the National Resources Defense Council. And actually, Michigan's Department of Health and Human Services put forward a very extensive risk assessment in December. We have published case studies from a relatively small but growing number of clinical researchers, and we have emerging scientific research. So to go back to the epidemiologic data, most of what is going to be quoted in presentations and in the literature comes from the C8 Health Project. And this arose out of an exposure in Parkersburg, West Virginia, where there's a manufacturing plant that contaminated the area heavily between 2005 and 2014. They found probable links to thyroid disease, high cholesterol, pregnancy-induced hypertension, testicular and kidney cancer, and ulcerative colitis. Again, a causal relationship couldn't be established. There have been other reports with inconclusive evidence that suggest a relationship to osteoarthritis, attention deficit disorder, endometriosis, altered liver function, chronic kidney disease, cardiovascular disease, and neurologic disorders. Both the EPA and the International Agency for Research on Cancer have classified PFOA and PFAS as possibly carcinogenic. There is stronger evidence of association with kidney cancer, prostate, and testicular cancer, and softer evidence on bladder cancer and thyroid cancer. There are other studies, a lot of these done in Europe, that demonstrated links to things like a higher percentage of abnormal sperm with morphometric changes in the sperm head and tail, lower testosterone and smaller genitalia in males. This actually comes out of an Italian study in an area with very high exposure, and they tracked males from birth who had been exposed in utero up through high school, and actually were able to measure things like the distance between the scrotum and the anus and the size of the penis, and found definite changes in those with a high exposure. Other studies have reported a longer time to pregnancy in multiparous women with high PFAS levels. And now there have been several reports looking at reduced antibody response to the rubella, diphtheria, mumps, and tetanus vaccines in children. As Courtney said, one of the ways that we believe that PFAS contribute to human disease is from endocrine disruption. We already talked about the fact that they play a role in male genitalia in development. They've been shown in multiple studies to affect levels of thyroid hormone, with some suggesting that it's because the PFAS compounds interfere with binding to receptors in the thyroid and pituitary. And other studies have shown that PFAS can bind to the estrogen receptor, and that prenatal exposure delayed mammary gland development in mice. Courtney may know a little bit more about this, but when you try to ask yourself what the mechanism might be, it does appear that in the case of altered immunity, it's possible that this is because the antigen can't bind to the T cell receptor and activate the T cell. And there's also evidence of suppressed B cell immunoglobulin synthesis. And when I look at everything we've talked about so far, in my simplistic mind, I think that we may be injecting Scotchgard into our veins and somehow preventing access to binders by these compounds, which is why it affects immunity and also endocrine activation. Other studies have shown a direct elevated cholesterol, and a direct toxic effect on the liver has been demonstrated in some of the animal models. Cancers, prostate and testicular, again, these are hormone-driven, so one wonders if it's by hormone disruption. And the kidney is actually a site which has maximum exposure to these compounds because they're being persistently filtered and reabsorbed. So the health conclusions that you can reach are that this is a rapidly expanding body of evidence that PFAS pose major health risks to humans, wildlife, and the environment. They're widespread in our environment, contaminating our ground, our surface water. They bioaccumulate in soil, plants, wildlife, and humans. There's growing evidence that these chemicals are endocrine disruptors and carcinogens, that they alter immune function, and that they impact fertility in both fetal and child development. And in order to protect human health, there is a compelling, urgent need to regulate the entire class of PFAS, including the short chain, to restrict their use, to identify and clean up contamination sites, and to educate health professionals and the public about these risks. So I would urge you as this class of health leaders fellows to learn about PFAS and stay informed about how it's impacting your community, to advocate, get to know your legislators and participate in town halls and meetings. My reps know me. Work with other environmental groups that share our mission. The Sierra Club recently had a webinar on PFAS as well, and the Huron River Watershed Council has also had a community meeting. Reach out to your friends, your family, and your coworkers, others in your sphere to talk about these risks and develop ways to minimize their use, and to educate other health professionals and patients in particular about the risks of PFAS and what they can do to protect their health. And we do have a PFAS fact sheet that we're developing right now for the Huron River watershed that will hopefully be finalized and distributed to you when you have your next in-person meeting. Thank you.
Thank you, Elaine. This is Becca. I hadn't introduced myself before, and I'm going to take a few moments here to talk a little bit about some of the next steps and what we'll be working on with you all throughout your practicum phase of the fellowship program. I need to switch things on my screen share, so bear with me. All right. So I believe you can see the new slide deck now. So what I want to focus on is a number of different public policy solutions at the federal, state, and local level that we're engaging in here at the Ecology Center with our partners, that Elaine has actually been a terrific partner on in terms of coming up with materials as a fellow that we can use that are evidence-based, science-based, that we can take to lawmakers at various different levels here. So I'll go quickly so we have time for questions for everyone. But one of the things that I wanted to highlight is that our Michigan congressional delegation has really been showing tremendous leadership on PFAS. There are a couple of different bills that I listed there that have been co-sponsored by many members of our delegation in both the House and the Senate. And that PFAS Action Act is just one example here. It would designate all PFAS chemicals, the entire class, as hazardous substances under Superfund, which is critically important for places like in Oscoda, Michigan, where you have contamination at an Air Force base, and you don't necessarily have the resources available under Superfund for the EPA to clean up that site. So now there's a bit of a push and pull between who is responsible to clean up the site, the Department of Defense or the state of Michigan, which really leaves the people of Oscoda in the middle there without a good place to go to get cleanup for that particular site. So I think as you saw, and Courtney can correct me if I'm wrong, I think in her slide you could see that the Pease site was a designated Superfund cleanup site. So that's going to be critical for a number of sites here in Michigan going forward. There are other PFAS bills underway, and at some point we'll get into some other details with that for folks who are working on this for their fellowship practicum project, but I'll leave it right now with this one. So earlier this spring, Governor Whitmer directed our Department of Environmental Quality, which is actually now called our Department of Environment, Great Lakes, and Energy, to begin the process of setting a health protective drinking water level or a maximum contaminant level for 5 different PFAS chemicals. Those are those 2 commonly known long chain chemicals, POFA, POFS, and then the 3 others are PFBA, PFHXS. So if you remember Elaine's presentation, that's that short chain with a super long half-life, and then PFBS. Right on the tails of that announcement that they would be setting those levels, which are actually won't be finalized until around April of next year. They have to go through a somewhat long regulatory process in the meantime. However, we do expect preliminary information out of a work group on what the recommended health-only focused levels by July 1st. The state also put together those new screening levels that Courtney mentioned in her presentation, so you can see them there. So we've been working on an action level in Michigan of 70 parts per trillion for combined PFAS. And so now you can see we have the levels are a little bit different there. Some of them are quite low, 9, 8, 9 parts per trillion. You have a little bit higher for the two of the short chain chemicals there at the bottom of the list. So there's been a little bit of action actually in the legislature in this year. Last year, Elaine joined us when we went to a hearing on PFAS in the Michigan House Department of Natural Resources, and some of our other fellows from our program before attended as well. Elaine submitted written testimony for that meeting. Unfortunately, we didn't have an opportunity for her or for others to speak at that informational session. It was just internal staff in various departments of the state. However, last month, and actually just into April, there were a number of hearings on 3 different PFAS and firefighting foam bills, House Bills 4389, 4390, and 4391. And the first one of those would establish a take-back program for existing foam stock that was introduced by Sue Aller, who's the representative from Oscoda. And then the other 2 would provide for more information on PFAS, or on actually toxic chemicals in firefighting foam generally, so PFAS and other replacement chemicals, to ensure that firefighters are protected and know how to use those and know how to protect themselves and the environment, and then a ban on the use of PFAS-containing firefighting foams in training exercises generally. So we participated, and I submitted testimony on those bills, and we can share that testimony for you. We also participated in a work group process and got critical improvements to those bills, which brought the Ecology Center from neutral on 4389 and opposed to the other 2 to supporting 4389, because it will include the short chain and the long chain chemicals in the Take Back program. There is also funding for that program already in an appropriation from last year, so it's not an unfunded mandate. There's money to take them back. And then being able to be neutral on the other 2 bills that may have some impact. The reason we're neutral is because we don't actually feel like it will have as great of an impact, and we don't want people to think that we're done here. We need to take further action like folks have done in Colorado and Washington State, and a growing list of states that are passing full-on bans on the sale, use, and distribution of PFAS firefighting foams. We have additional resources that we'll share for you that get into the details here, so I'm sure you may have questions. So beyond the state level, we all know it can take a very long time to move the federal government or state government to make change. So I wanted to highlight a few things that have been happening here in Ann Arbor and how we at the Ecology Center will be working with you all as fellows at all of these levels, but in particular at the local level to make changes to get PFAS really out of use in the marketplace in our communities as soon as we possibly can. Last year, the city of Ann Arbor passed a procurement policy that addresses PFAS and other toxic chemicals, as well as things like recycling and compostability of products. This is being seen as a model procurement policy. So what that means is that the city of Ann Arbor, with their own resources, their different units and departments, cannot purchase products, giving the example of PFAS, that contain PFAS chemicals. And their policy is now, we're working with them to implement the policy to look at how do you phase that in with various different product categories. And so we're working with them. We're also working with the Michigan Green Communities group, which is a number of different cities, townships, counties that are interested in sustainability and how they can become more sustainability in their areas. To forward that procurement policy, we have a webinar which we'll share information with you all on that's scheduled for June 17th with Michigan Green Communities, Safer States, which is a national coalition working on procurement policies related to toxics, and various other national organizations. So the other thing that localities can do is work with their own fire services, their fire departments, to remove the firefighting foam containing PFAS from the shelves. We're expecting that next week there will be a hearing on those state level bills that I mentioned, and we expect those to pass through the House Natural Resources Committee, which would be the first critical step to being able to implement that take-back program. So the City of Ann Arbor worked with the fire department and their water treatment facility to remove all of the PFAS firefighting foam from use, and then find a fluorine-free alternative that they could use when they need to address the hydrocarbon fires. Hydrocarbon fires are like petroleum-based fires. So if a car were to catch on fire, or a gasoline station or something like that in a community. There's other things that communities can do in order to treat for PFAS in water. Here in Ann Arbor, they're using over 26 giant granulated activated carbon filters to filter our drinking water here to try to get the levels down. Unfortunately, you still see some spikes of the short chain chemicals that are coming through, even in the treated water, and I think Courtney mentioned this, the granulated activated carbon doesn't capture all of that short chain chemical as well as it does the longer chain chemicals. And then there's ongoing testing by both the water treatment facility and others, the state of Michigan, to look at Ann Arbor's drinking water. So that's one little example there, what can be done locally. We'll also be working with other impacted communities. Some folks up in the Belmont area of Michigan are working with me on both procurement and to have their township move out of the PFAS-containing firefighting foam. So those are just a few things I wanted to add there. There are different market actions that Lauren will be able to clue you in on as we go. This action here is something you could do today, which is a national action to make the companies that produced these chemicals actually pay for cleanup and treatment, so it's not taxpayers' burden there. So those are a few things I wanted to share with you. This is one example of the fact sheet that we worked with Elaine to create last year, and we'll share this all with you, as well as her literature review and the new fact sheets that are coming out on the Huron River water contamination. I will leave it there and open it up for questions for folks.
Great. Thanks to all of our presenters for all of that awesome information that you shared with us. We are opening it up now for questions. So while folks have their questions start to roll in, we do already have one over here. Does cleaning around the house help reduce flame retardant exposure?
Is that one for me?
Yeah, Courtney, we'll let you take that one.
So I see that suggestion a lot, and it bothers me. I got to be honest, because it doesn't seem to matter how frequently, like the actual levels in the dust, aren't affected by how frequently you clean. If anything, the more frequently you clean, you just have less dust, right? So it may help, but the actual cleaning itself might expose you to more dust. But I think the vacuuming, like using a HEPA filter when you vacuum, probably helps. I haven't seen actual studies that have looked at cleaning frequency and exposure. So I think the answer is it should probably help, especially if you're being careful, if you're the one doing the cleaning, to make sure to not be ingesting or breathing the dust as you're cleaning. So.
I think I would agree with that, Courtney. I think one of the things for folks to think about is if you're familiar with cleaning around homes to deal with like lead contaminated dust, what you want to do with lead or flame retardants or really any chemical contaminated dust is use the methods like using a HEPA filtered vacuum, using wet cleaning methods rather than dry dusting, using the microfiber products, which have some other environmental issues, but using things that capture the dust and don't just puff it up around you so that you have that exposure. I do think that it's critically important, particularly with things like vacuuming and getting dust up when you think about children's exposure. And Courtney had talked earlier about the fact that children have 3 to 10 times higher levels of certain chemicals like flame retardants in their bodies. And that's because of their just general, very otherwise healthy childhood behaviors. You know, they live and play closer to the ground, so they're going to be exposed to more dust particles that way. Young children, toddlers and babies in particular, explore the world through hand-to-mouth behavior. That's how they learn and that's how they develop. And so making sure that they aren't exposed is going to be really critical because of the critical developmental windows that babies, children, and others are going through at any one particular period of life. So it's not just cleaning generally, but cleaning the right way to keep dust down and to reduce exposure. Good question.
Right, but I think the other thing that bothers me about that suggestion is that it's a little bit of a blaming the patient, like, especially as a very busy mom, like, oh, now I need to clean more frequently because these chemicals are in my home, and something else to feel guilty about if I'm not able to. And really the public health intervention that will be the most effective, of course, is getting these chemicals out of these products so that people don't have to feel guilty for not cleaning more frequently. Does that make sense?
Absolutely. And that's why we were working with all these folks on the public policy side of things. Yeah, definitely.
This is Lauren. I was wondering with the new TB 171, so the technical bulletin in California that allows furniture to not use flame retardants as much just because the tests have changed. So if you use polyurethane foam, you can get away without using chemical flame retardants. I just wonder if any biomonitoring studies out there have shown that flame retardant levels are actually decreasing due to it, or if it's going to be a pretty long lag time just because people hold on to their furniture for a long time.
Yeah, there's one study that showed that levels may be coming down, but certainly in the US not coming down very quickly, and probably exactly for that reason. And then there's another study that's being done where actually intervening, like an intervention study where they replace, I think it's in California, they're replacing foam furniture that has flame retardants in it with, actually we're swapping out the foam with flame retardant free foam and measuring whether there's a reduction. I'm not sure if that's published yet.
Okay. I'll hand it back tomorrow.
Yeah, I think it was published, and I think it did result in a reduction. I'd be surprised if it didn't.
Okay, great, thank you. So our next question, Becca, this might be for you, but other two presenters, if you have anything else to say, please feel free to chime in. But the question is regarding the steps that have been taken by Michigan legislators at the federal level. How can people here in Michigan be supportive of their actions?
Yeah, we can share with you a list of the different bills that have been introduced, and we can talk to you a little bit, show you how to find out if you don't already know who your own congressperson is, just how to find that out, and to communicate with them directly. You know, lawmakers often hear a lot of complaints from their constituents and don't always get praise. And so that's really important to say, like, hey, you know, for the PFAS Action Act, thank you so much for co-sponsoring this. I think that's in particular, it's very important for our Republican members of Congress in Michigan right now. Congressman Upton in the west side of the state has actually been taking on a more leadership role on the PFAS Action Act and a number of other initiatives. He also, he's a long-term congressperson who has a fair amount of power in his committee with his side of things, not the House, so they're not in control anymore, the Dems are. But it's important to encourage that bipartisan sponsorship and work on these bills together so they can get through with a divided Congress, essentially. So we can share with you when new things are introduced, or there's a particular moment where there might be a hearing. We don't have any meetings set up right now. There was a national lobby day, and we're hoping that there will be another one. Back in May there was one, and we didn't have anyone necessarily from our fellowship program who was able to participate in that to meet with members of Congress, but you don't have to go to DC to do that. We'll work with you to set up in-district meetings, and Elaine mentioned that many state lawmakers or Congress people have constituent coffee hours or town halls and things like that. And so there's opportunities to talk to them about these issues, to thank them when they have done good work, and then to encourage them to do more or to do something if they haven't taken any action at all. That's a great question.
Okay, for the next question, I'm turning it back over to Lauren.
Courtney, I wondered if you wanted to talk about any other research that you have coming up. I think you mentioned your biomonitoring study at military sites for PFAS, but anything else that you have in the works?
No, I think I'd mentioned the 2 major studies I'm working on right now.
Cool.
The Agency for Toxic Substance Disease Research actually has a toolkit now for assessing these high-risk populations, and the Michigan PFAS Response Action Team has started a biomonitoring study of people who were exposed up around the Wolverine plant.
Right, so that's one of the projects I mentioned that I'm assisting with.
Mm-hmm.
I think I didn't get real specific.
You know, one of the things, I'm tacking back to flame retardants, the presentation that I put together on public policy initiatives was really focused on PFAS, but there are a number of different things on flame retardants as well. All of the procurement policies have very good, strong language on flame retardants and products, and there's quite a few product categories that states or communities, cities are purchasing that contain these both of these toxic chemical classes. But on the flame retardant side of things, if you remember back to Courtney's slide where she showed the furniture, you have office furniture that you could swap out, you have the carpeting that can be swapped out without these chemicals, building materials like foam, insulation, and so on and so forth. So there's actually quite a bit of impact that can be made there. And I didn't note this, but you'll hear when we have our webinar about our facilities, these similar actions can be taken within healthcare institutions to reduce their impact on chemicals in the environment. So through the Healthier Hospitals program, and in conjunction with Practice Green Health and Healthier Hospitals initiative, Healthcare Without Harm, hospitals can take on challenges to reduce their chemicals that they're using in their own facilities. So that's everything from flame retardants to PFAS to phthalates, which I had mentioned in the orientation session, another endocrine disrupting chemical, and so on and so forth. So that's something to look forward to when we have our Facilities Day discussion and webinar, and then visit to learn about some of those other impacts that can be made within healthcare institutions.
Yeah, also the quants, the antimicrobials.
Yeah.
That have a purpose, but also medical professionals can have high exposures, and so should be aware of.
Right.
So our next question is for Elaine. Elaine, you mentioned in your presentation that prior to getting really into the weeds on PFAS, you had not been familiar with the work. How did you get started, and do you have any recommendations for other health professionals who are trying to get more involved in similar work?
Well, I have the advantage of being retired now and having a lot of time, which I think is a real handicap for most physicians, at least. But you know, the fellowship, I contributed to the Ecology Center, and I got a flyer, and I applied, and I thought that they really wouldn't want me in the program because most of the people who are active are actually working someplace where they can apply a lot of what they're doing. But what I found in the fellowship, the reason I got interested in PFAS is that, as we said, I've spent 30 years as an oncologist. And I've spent a lot of time sitting in exam rooms with people who ask me, why did I get this cancer? And I can look back at things like asbestos, at people who worked in paint shops, you know, this stuff from 30 years ago, and talk to them about that. But what really struck me about PFAS is that these are chemicals where an oncologist may be sitting with people in 10 or 15 or 20 years having that same conversation, and that we have the ability to intervene now. And I think that's what my passion is about this, that the writing's on the wall with these chemicals. We may not have all of the data right now about how they work, but it's clear when you look at the hints about their mechanisms that long term these are going to be very, very bad things. So they're going to be with us for a very long time.
Great, thanks. And with that, we don't see other questions in the queue. So with that, I just want to take a moment to thank our presenters again for taking the time to present for us today. As a reminder, all presentation materials will be available tomorrow. And with that, just a couple quick housekeeping items. As you can see up here, we do have an evaluation. Our webinar evaluation is required for all current Health Leaders Fellows. However, we also strongly encourage all other participants to complete the survey as well. Your feedback is valuable in planning future meetings. So I'm going to chat that out now, but it will also be included in the materials that are sent out tomorrow. And our next event will be Media Training Part 1. We'll be joined by Sam Inglot from Progress, Michigan. This webinar will cover all things media and will help prepare you for our in-person media training session. And the registration link for that, I will chat out as well. Great. But other than that, thank you again for all of our attendees for joining us today. And thanks so much to both Courtney and Elaine for taking the time to present. Enjoy the rest of your day, everyone.
Thanks, you too.
Thank you.